Hey everyone, it's Dr. Ellie here again with my podcast, I Heal Kids. And if you don't know me, I'm a holistic pediatrician in Asheville, North Carolina, and I see kiddos 0 to 21 for holistic pediatrics. And I also see people who are age 2 years to 102 years for functional medicine. And if you don't know what functional medicine is, definitely check out my other pods because I've done quite a few on that. And if you need help with it, definitely reach out and schedule a complimentary meet and greet because I would be excited to meet you. So today we're going to jump right in. I'm doing the fourth part of my 4-part mini series on all things poop. And I'm going to be talking about the microbiome. I mean, come on now. We all want to hear about the microbiome. Everyone's talking about the microbiome. What is a microbiome anyway? And why does it matter, especially for your child's inner ecosystem? So, just to jump right in, a microbiome is basically like a forgotten organ. So, the way to think about it is it's a community of bacteria, viruses, fungi, and different things that are kind of living mostly in the gut. And part of the gut is the mouth and all of that. It is just this community of bugs that live there. And for the longest time, a lot of people were like, whatever, there's bugs in your gut. No one really paid much attention to it. But it turns out it's extremely important for like a lot of different things, all the way from like your brain health to the way your skin functions to the way you detox and all of that. And we'll get into it for sure. But basically, it's something that starts developing even before birth and it continues all through infancy. It's shaped by how the birth happens, whether it's vaginal or C-section, whether you're breastfeeding or not able to breastfeed, how many antibiotics, all of that, and the environment. Let's dive into like, why is this even essential for your child's health? Why would we even care about this at all? Okay. So first of all, digestion and poop, which I talk about poop, y'all, every single appointment of my life. So I know that you guys want to hear about, what is normal poop in kids and what is not and all of that. But essentially, when it comes to the microbiome, what happens is a mature microbiome will aid in digestion. It'll aid in the way that you're able to process your food, how you are able to make vitamins, how you're able to absorb things, maintaining healthy bowel movements, so we're not getting like problems where there can be issues. So like, for example, if your microbiome is disrupted, you might have like gas or constipation or mucus or diarrhea and things like that. Another thing that's really important for that a lot of people don't know is actually your immune system function and growth. So let me back up. There's a lot of your immunity that's actually like happening in the gut. And, according to the New England Journal of Medicine, I was going to say NEJM and I couldn't spit it out. It's New England Journal of Medicine. The microbiome actually trains immune cells. So this is something that's really important. So if your microbiome's off, your immunity may not be good. Your child may be getting sick a lot. There can be other factors for that, but this is definitely something that we need to address. There's also like some other things that kind of show, that it could disrupt growth. But a lot of times it has more to do with kids that have like diarrhea and, not having a good microbiome based on that. Like, let's say you live in the Peruvian Amazon, then, you can have faltering growth because you're just getting diarrhea all the time and your microbiome's really messed up. So, I mean, for most of us in the US, well, I don't know. I have seen some pretty messed up microbiomes. I'm not going to lie. I was going to say for most of us in the US, we don't see this, but in my patient population, I see this a lot just because people are coming with a lot of problems where they're having a lot of diarrhea or they're not digesting food well, maybe they're not growing well and all of that. But for sure, if you're living like in a developing country and there's a lot of diarrhea going around, it could definitely affect growth. Another thing it can affect is your brain health and behavioral health. And a lot of people don't know this, but gut microbes can actually regulate neurotransmitters. So neurotransmitters are basically hormones in the brain. So things like serotonin, our happy calm chemical, dopamine, our focus chemical, GABA, another calming chemical. And all those things influence like our mood, our focus, our sleep. And so, things like dysbiosis being like the microbiome kind of going out of whack and like things growing that we don't want growing there or overgrowing. Those can be actually associated with things like ADHD type symptoms, inattention, hyperactivity, anxiety. And some kids who are on the autism spectrum really don't feel well when their microbiome is out of whack. They can get a lot of symptoms. They can have some behaviors because their tummy is really, really don't feel well at all. Detox and skin health. So, another area that the microbiome affects is actually how well we can detox, how well the liver can detox, more specifically, and also how the colon functions, which I think is maybe a little bit more obvious. And okay, so I think we've talked about this before, but just as a little refresh, the ways that the body can detox are sweat, pee, and poop. So what are we talking when we say detox? Detox is a little bit different than like maybe like a cleanse. I don't know. I make a little bit of distinction between those two things because detox is happening like all the time. And so if there's toxins in your body, you're going to pee them out, you're going to sweat them out, or you're going to poop them out, assuming they are water soluble and you are actually drinking water. Parents, coffee, not really water. I wish it was. I wish coffee and tea were water, but water is water. Anyway, so you need a lot of water. Kids need a lot of water, especially in the summer, not young babies, but older kids and all of that. So if you can drink water, you will get rid of those chemicals. Now, if the toxins are not soluble in water, meaning your body, they don't dissolve in water. They can't be carried by water. Like they don't mix well. It's kind of like if you have you all made a vinaigrette, like an oil and vinegar vinaigrette, like for a salad, and the oil and the water don't mix that well together, and you like can whip it with like a whisk? Yes, a whisk. Okay, not a cooking expert. Do like to cook, but this girl is not the next Rachel Ray. But anyway, the whisk, you have to whisk it really hard to like emulsify it, but it never fully mixes. That's what I'm trying to say. The same in the body, like the things that don't dissolve in water, kind of like that oil, the liver has to process and do something to it to make it to where the body can pee it out. So if the liver is not working well to do that reaction, it's called a phase 1 and phase 2 reaction, which whatever, doesn't really matter, then you can't get rid of those toxins. Now, I just want to say, small note, y'all, who are buying all those detox things on the internet, I get it. And if your digestion is not working well, if your microbiome is not working well, anyone 16 and up, if your adrenals are not working well, you don't want to do a huge, like massive detox. Definitely don't try and do one while you're pregnant or breastfeeding. I would much rather those chemicals stay in your fat where they're situated and not doing anything than coming out of your body and causing problems. Okay. So if you're going to do a detox, definitely get in with a functional medicine provider so you know when to do it safely, how to do it safely. All of that. Don't recommend just kind of going off on your own and randomly doing like a detox type situation. The main event is you have to have a healthy working gut for your detox system to work. So if you don't have a healthy gut, you can't detox well. And because of the combination of those two things, sometimes you can get symptoms like anything from rashes to brain fog to poor digestion. Gosh, what else do people have with this? Long COVID symptoms. I mean, the list goes on and on. Just exhaustion, that can happen too. Okay. So like, how do we make sure like our kids, ourselves have a good microbiome? What harms the microbiome? All of that. So the factors include method of birth. Now, I am not here to tell people like never, ever, ever get a C-section. Of course, there are times where it is just not safe to do that vaginal delivery. Now, if we can, and everything's going as planned and there's no major emergency, if you can choose to do a vaginal birth, that is a lot better for your baby's microbiome. So when the baby is like pushed out through the birth canal, the vagina, there's a lot of like bacteria and things that kind of live there, and the baby gets seeded with those, and that helps them have a good gut health. Now, for those of y'all that have to have a C-section, it's not the end of the world. As far as the microbiome, there is something at least you can do. So you can actually have the nurse, the doctor, your partner, whatever, take some of those vaginal fluids and swipe them in the baby's like mouth, which I know sounds kind of gross, but it's like what happens naturally. Breastfeeding, again, there are circumstances, you guys, that people cannot physically breastfeed. I am not here to shame anyone that has to use formula. Absolutely not. We will work around it. However, if you have the option to breastfeed, you can breastfeed mentally, physically, all of that. It is better for the microbiome in general. Antibiotics. Okay. If you don't need an antibiotic, don't use an antibiotic. If you do need an antibiotic, then have a discussion about it and see if it's something that you really need. So if you're in a setting like an urgent care or something where you're not quite sure if you're just getting something to be rushed out the door, maybe just ask the question, is this really necessary? And that can be very helpful in reducing the amount of antibiotics that people are just kind of giving you to quote unquote cover for some kind of unknown infection that someone's not quite sure if you have or not. So maybe ask one or two questions. Now, of course, you're super sick, you're in the hospital, you are in sepsis, you have a horrible pneumonia. I mean, that may be a time that we need to use an antibiotic and then clean it up on the back end. So, like doing some probiotics and things on the back end to help restore the microbiome. If your kid's running around with a head cold and, a little bit of a cough, and your pediatrician is telling you you don't need an antibiotic, maybe don't give the antibiotic because it really messes up the microbiome. Plus, it probably will give them diarrhea. Plus, it's not going to help the cold anyway, which is a virus. So, yeah, just, word of caution on the antibiotics. Okay, we don't want to go overboard. What else affects it? So, everyone's favorite topic, food. Now, I know that a lot of y'all have picky eaters out there. I get it. And it's like, okay, mac and cheese, the chicken nuggets, the french fries, and buttered pasta. And that is what your kids are wanting to eat. And sweets, right? Honestly, sweets are sweet. They taste good. That's why we love them. It gives us like a little dopamine hit. We feel amazing, all of that. But oh my goodness, the sugars, the processed foods, the food dyes, the lack of color in our diet, all of that is going to influence the microbiome. So, if we're not eating polyphenols, which is like something from berries, then the microbiome is affected. If we're not doing fiber and prebiotics to make the microbiome grow, so things for those bugs to eat and feed on, that's going to mess things up. And taking a bunch of, toxins from the environment, like weed killer and things like that, that's going to mess up the microbiome. So I'm not here to shame anyone. I would never judge anyone or anything like that. I'm just letting y'all know we really, in order to make a really healthy microbiome, to influence our kids' brain health, the way they function, all of that, we really do need to make sure they're eating a variety of foods, a variety of color, textures, veggies, all those things. If you're not vegan, vegetarian, you can do a little meat, but that's for a different reason for the processed foods. But we've got to get away from all of the things that are in the boxes and all of that. And if you're not sure what to do about it, I did a really good podcast with Stephen Kempler all about feeding therapy. Some people really struggle with this, especially people on the autism spectrum or have food or texture sensitivities. Those kids really require like a lot of extra support and may even need a feeding therapist to kind of get over this. But for just the general picky eater, I would recommend just trying to make sure that you're always offering those foods, even if your kids are rejecting them, and see if there's a way to bridge foods. So if you have something that says similar color or texture, see if they'll take a bite of something else that's also of a similar color or texture. And then put it all in the same plate and see how it goes. And then, of course, we have to have boundaries and all of that really fun stuff. So fun having boundaries. Environmental exposures. So, there's some things about like EMFs and screen time and all of that. I just think in general, that less is better. I mean, being on the screen all the day, I know that it affects my mood. And like a small brain like that, being on a screen all day, not getting outside and playing, not being in nature, all of that can affect it. And then also for older kids, making sure they exercise, because exercise also, I always say older kids, but everyone should be exercising. It's just that younger kids are more like running around outside and playing rather than, like a formal exercise routine, because, there's not that many toddlers that are on a treadmill, I hope. Okay. Excess hygiene. This is like, if you're getting really obsessed with things being clean. So there's actually like some good studies on kids that live like on farms, and living on the farm, they actually do end up having like less asthma and allergies and things like that. And the thought behind that is they're getting exposed to some more bugs. So we're just living in such a clean world right now that our immune system's confused. It's like not even sure, what is something that is bad, what is something that is good. We're clean all the time. It affects our guts because now we're not getting populated with things that we should be. Now, that's not to say like don't wash your hands after you go to the bathroom or your kid's sick and they have diarrhea. Like, of course. But like all of the like bleach chemicals and all of the, hand sanitizer like 10 times a day, and it can get to be too much. Okay, so what can we do to build a healthy microbiome? And also how can we rebuild one if we've kind of gotten a little off course? So The first thing would be breastfeeding. So if we can breastfeed, all the better. If you have to do a formula, choosing one that's a little bit more healthy. And I do talk about that in my course. So you can see like all the formulas that I recommend if you're interested in that. And then for, when we start solids, we want to introduce diverse plant textures. So, a lot of us actually, when they've done studies, it shows that we're eating like the same four vegetables over and over and over and over and over. And I just think, like thinking back, what did I eat when I was a kid? It was probably like carrots and cucumbers and tomatoes and corn. I was a pretty good eater when I was little and all of that. But even then, it's not the diversity that I'm eating now. So just being more aware of bringing in foods that you might not normally be familiar with or not even know. Like, for example, maybe you want to learn how to cook with cactus, or especially if it's in your tradition or if it's in your heritage, something like that can be really fun. Or maybe you want to try out doing more kiwis because you've noticed you don't have that much kiwi in your diet, or you want to try sweet potato instead of just carrots. So just like making sure that from week to week, we're getting a lot of variety. And then probiotic foods. This is things like, okay, so first of all, I do not expect your kid to sit down and eat like a jar. I mean, there may be some that will, but like having your kids sit down and eat a jar of kimchi or like an entire thing of sauerkraut, that's not what I'm saying. But it can be really helpful to take just like little pieces of those foods and mix them into other foods that they're eating, right? So like the sauerkraut and the kefir, and especially, you could do like coconut if you're not a dairy person, which we need to talk about that. But what was I saying? Oh, kefir, sauerkraut, kimchi, miso, tempeh. What else is fermented? I mean, there's so many. Just Google a list, you guys, of fermented foods and see if you can start mixing those in. Prebiotics. So this would be like, what is the bacteria growing on? And again, this is why we want like a diverse amount of vegetables and fruits in the diet, because a lot of the foods, so like bananas are good for this, asparagus is good for this. Some of the foods are better as prebiotics and some are better as probiotics. Fermented foods are usually better for pro. And then all the fibrous foods are better for pre. And then, of course, all the color, because we want what? Micronutrients. Micronutrients being our vitamins and our minerals, macro being like your protein, your carb. So just kind of making sure that we're getting variety. Now, when I talk about food, a lot of people have a moment of like, I don't know. I think it's just like a moment of like, oh my gosh, like this just feels huge. And I do get that. I really do. Because when I found out that I was celiac, that was a massive shift for our family. And just learning how to do things a little bit different and understanding like the inflammation, and then coming to find out I have a dairy sensitivity and how to handle that. And it's not a little thing when you have a big problem. But in situations where there's not a big problem, you do have a chance to be a little bit more incremental. I don't expect anyone to go from 0 to 100. So, if you've been on more processed food diet because of whatever, it's just faster or time or exhaustion or money, or, there's a million reasons why this happens, or just not really even knowing about like pre and probiotic foods. Sometimes you just have to go a little bit slower, especially with kids, and just start shifting things, a little bit healthier. So like, for example, maybe you've been doing Lucky Charms every morning. Okay. And it's like, sorry, Lucky Charms, but it's sugar, food dyes, kind of yucky, not too nutrient dense. So maybe you shift it to Honey Nut Cheerio. Is it the best? It's not the best, but it's so much better. And then maybe you go to the regular Cheerio. And then maybe you say, okay, let's try some oatmeal. And then maybe you start adding the spices. So you guys, this can be a little bit more incremental. Of course, everyone would love to go from 0 to 100 and be like, all right, kids, we are now on a whole foods, non-processed diet today. That will usually result in serious meltdowns and confusion on part of a child that's been living very differently because they don't understand it yet. So sometimes we have to go a little bit slower with children. Okay. Now, if you're starting from the beginning, please start introducing those foods earlier on. They may still go through picky phases, like when they're toddlers and all of that. But in general, for most kids, unless they are having sensory issues, getting all of those foods in early, it's just going to be less of an uphill battle overall. lifestyle. We talked about this in the beginning. What's not good? What is good? We need to get outdoors. We need to be in nature. We need to get off of the screens. We need to get away from all of those products that have toxins like BPA and phthalates and all of that stuff in them. And the other the other thing that people often don't really think about is stress mitigation. So when I talk about relaxation techniques in kids, it's usually crickets, right? Because who the heck thinks their kid is stressed enough to do relaxation techniques? Well, 100% as a pediatrician, I can tell you I am seeing kids younger and younger and younger with depression and anxiety. And it's very sad. I mean, 8, 9 years old with depression and anxiety. Okay. So these are things that we need to start early. And you have to imagine, or one could imagine, what we may feel is stressful as an adult versus what a kid feels is stress is a little bit different. So it's possible to think, well, my kid doesn't have stress. Like, what stress do they have? Well, for them, like going to the first day of kindergarten can be stressful. Trying a new food could be stressful if it's someone that's having trouble with that. It could be learning to read is stressful. It could be meeting a new teacher, learning how to talk with friends. There's so many things that kids experience day to day that you wouldn't think, okay, maybe that's like super stressful. And no, absolutely. It's not like this huge trauma, like big T, oh my goodness, we need like massive amounts of therapy type stress. But this is just like general life. Like, they've never seen a doctor before. They've never seen their teacher before. They've never seen how to do math before. And those things can be really stressful for kids. Plus, with screens, they now have the added stress of comparing themselves to every single other person in the entire world, which blows my mind. I mean, it's so detrimental. I know that if I'm on, doing market research or something for my business, I really can be affected. And like for a small child to try to learn how to process that information that not everyone is happy all the time, not everyone is winning in life every single day, having, success every single day of their life because that's what they're being fed. That is very stressful. So that can affect the microbiome. And depending on the age of your child, there's different things you can do, right? So from a baby, that's when you could, if one wanted to, you could meditate while you're breastfeeding or bottle feeding, and that's helpful because they can feel that energy. You could do breathing exercises yourself so that you're regulated, and then they'll feel that regulation as well. And then moving into like toddler years, you can do things like have them blow bubbles in their, whatever they're drinking. And you could even do the non-toxic bubble mixtures that they go outside and they, blow the little bubbles. And that's really fun because then they're also outside and in nature. You can do the kid yogas. You can do, books about stress, progressive muscle relaxation, all of that. And then, of course, teenagers, there's even more, right? So it can be a little bit more conscious on their part about tonight I'm going to do this nighttime routine where I wind down and take these herbs, and then I'm going to do some breathing and some stretching, and I'm going to put my device away. And that is not, if they have not been doing that, an easy sell. So that is why, if you have the option, try to get this stuff started early, because there may be pushback. There may be times where they're not willing, but it's in there. They know. They have heard it before. They know of these things. It's like a resource. It's something that's like a little seed. So maybe even if they're, saying absolutely not when they're 14, maybe when they're 17, they start thinking about it again. Okay. So we want to just make sure that we're talking about these things. Targeted support. This is when we start talking about like pre and probiotics. Again, we want to do a lot of prebiotics. I mean, there are some supplements, but a lot of that we want to eat those healthy foods. Okay. But the probiotics, things like Lactobacillus rhamnosus GG, Bifidobacterium infantis, these things, maybe they can help with diarrhea. Maybe you can do it as just a general microbiome support. Now, some of them have a lot of strains, and in most cases, that's okay. But some kids will get a lot of gas, and then we have to do one that has just like a little bit less strains. I did an episode all about babies and probiotics, or at least I think I did a part about babies and probiotics. Young babies, preemies, babies that have immune problems, things like that. You really want to talk about that to your pediatrician before starting a probiotic, because there can be times where it can be a little bit much to put a live bacteria into their system. Okay. So it's not always appropriate. Usually, generally 6 months and up, but there can be other circumstances where you may want to use something gentle early on. but you do want to have a discussion, especially for preemies, immune suppressed patients or babies or children or like severe health issues. Okay. All right. A quick note on buying supplements. I know that y'all, me too. I've done this. Okay. I say y'all, but I've done this. Okay. Before I knew better. You go on Amazon, you see the supplement, you're like, it's so much cheaper on Amazon. I'm just going to buy it there. Okay. There have been so many quality control problems with that, like poor refrigeration, poor heat control, things being stored for months and months and months, things being tampered with. I do not recommend that we go on Amazon and buy a bunch of supplements. Why? Because of those issues. So you don't even know what your kid is getting. And there's enough quality control issues in probiotic supplements. In fact, in nature.com on their published journal, they say that actually nearly half of probiotic products have quality control issues. So we want to make sure that it's a product that's third-party tested. We want to make sure we're getting it from a reliable source, and we want to make sure that it's being stored correctly, and we want to make sure it's not being tampered with. So definitely, I don't know, definitely, but like maybe it's fine to like order bookshelves or something that you're not eating on Amazon. But would I take a probiotic or give one to my kid from there? Absolutely not. So if you need any of that stuff, go to fullscript.com, my dispensary, which I will link below, so you guys can get probiotics that are like safe for your kids. For babies, the ones I really like, HMF Natogen, it's a little less of a gas producer. And then I like Claire's Therabiotic Baby. They also make a kids version. Those are all good. I think I have a whole list about ones that are good though. So if you go there, you should be able to find them. Okay, so let's say your kid's been having issues, whatever it may be, brain health stuff, gut health stuff, whatever it may be that you're trying to improve their microbiome for. And you've done all of this. You've changed their diet. You've done their prebiotics, their probiotics. They've got all the color. You're not, on the screen all the time, all of that. What else can we do? That's when you may need to come and see me, and we can do the GI map test, which looks at the microbiome. It's a poop test, so there's no blood. And we can see what's in there, what kind of bacteria, what viruses, what protozoa, worms, all of that. See if there's reaction to gliadin, which is something in gluten. We can see like how well you're digesting food, all of that. We may want to do your organic acids, which looks at the gut in a different way. It also looks at your detox systems. It looks for neuroinflammation in the body. It looks at how well you're metabolizing food, your vitamins, all of that. And then also we may need to do, possibly elimination diets, which I always try to do only if need be, because they're really hard, where we're trying to figure out, like, is a kid having a reaction to food? And then we may also have to do some other supports, right? So, whether it's like specific gut support, specific brain support, specific detox support for the liver and all of that. So just depending on what symptoms your kid has, if microbiome support isn't enough, then we might have to dive a little bit deeper. And that's where functional medicine is really helpful. Okay. So I think I talked about that enough. Let's talk about kind of just stories. I just want to share like a real example that happened very recently of microbiome stuff gone awry. So in my practice, I'm seeing a kiddo that has eosinophilic esophagitis, which for those of y'all that don't know is basically really bad. Okay. It is not one that you want your kid to have. So it's essentially a chronic immune system disease where white blood cells will build up in the esophagus. White blood cells called eosinophils build up in the esophagus, and that will cause inflammation and damage to the esophagus. So like the esophagus being the tube that you eat, or the tube that when you swallow the food goes down rather. And that can lead to a lot of really bad symptoms having these eosinophils, okay? You can get food stuck, which is like, not helpful at all. You can have trouble swallowing. You can get food impacted where, it's not moving very well at all. heartburn and chest pain and vomiting and abdominal pain and not wanting to eat because it hurts, and then not growing well. Why? Because you're not eating well. And there's a lot of things that can trigger this. Foods can trigger it, environmental allergies. There's a lot of different things. And a lot of these kids have to get a lot of endoscopies, which is where they do like they put like a camera down and have to like examine for signs of inflammation and rings and furrows and plaques and all of this stuff. And then they do biopsies where they take samples to kind of see like how many eosinophils are there, are things reacting, all of this. And there are medications that can control. So, on the conventional side, things like corticosteroids, like those inhalers, PIs, like Pepcid, things that help with the acid reflux, God forbid, where they have to go in and dilate the esophagus and things like that. And there are biologics for kiddos that are very, very severe, and food elimination can also help. And I think this is something that's going to, most kids are going to require some level of management throughout their life with holistic and probably also conventional at the same time. I don't think this is one where you just kind of want to wing it. But I will say this kid that came to my practice was vomiting every single day of her life and was told she could not eat, I think it was 9 foods. So you can only imagine as a parent, like what do you feed your kid at that point? And was having so much pain and discomfort and all of that. Long story short, I tested her microbiome and she ended up having H. pylori infection, among other things, dysbiosis and all of that. And I did treat that. And she actually is not vomiting. So she had 1 episode of vomiting, I think, last month related to just like, kid food choice, which happens. And then some upset tummy this month related to some like life transitions. So this is something that can be life-changing, you guys. It's not just something that we need to just kind of pass over. We really need to get microbiomes rebuilt and working well if they haven't been made well already, but better to start young. Okay. And it's not that this, person could have prevented the eosinophilic esophagitis. It's just that now we just need to like work on it and get it back on track. So I don't want to imply that anybody's chronic illnesses are like caused by themselves. That's not what I'm saying. I'm just saying, as a holistic practitioner, we can add in these other modalities to help, support and complement, what the gastroenterologist is doing. Okay. And hopefully give that child a little bit more relief. I feel like I've talked a lot. Oh yeah. 35 minutes. Okay. I think the last thing I just want to say is I did make a whole course on how to feed your baby from breastfeeding all the way, breast and bottle, by the way, for y'all that can't breastfeed. I get it. I hear you. All the way up to 12 months old. And the reason that I did this is I really wanted to teach you how to proactively support the microbiome, what to feed and when, how to have toxin-aware living, poop visual guides, how to build a healthy microbiome early on so that hopefully we can, in fact, prevent these gut issues before they start. So if you want that or you need that, I will link that in the show notes as soon as it's done. I think is a little bit more that I've got to just do, but I will link it. And we've talked about a lot, you guys. We've talked about how the microbiome is dynamic. It's essential for gut, immune, brain, and detox health. Early life is a very impactful window around birth and feeding and antibiotic exposure. So we just really need to focus on a few things. And you're never stuck, right? I want to emphasize like that the body is always trying to heal. It's always trying to get better. And so, if you have the right supports, then a lot of times you can overcome some of these issues. So if you have any, lingering gut issues or brain health issues, ADHD, behavior issues, you're burned out as a parent, you're stressed out as a parent, you're exhausted and have brain fog as a parent, any of that stuff with those lingering type symptoms, schedule a meet and greet or schedule a consult with me because I'd love to have you. I'd love to take a deeper dive into your gut health, all the things, adrenals and detox and all the things that we would need to do. So just go to middlepathintegrativepediatrics.com and you can see the link at the top of the page to book the meet and greet. So I am wishing you guys well. Thanks for coming. And if you don't know me, again, Dr. Ellie with Middle Path Integrative Pediatrics in Asheville, North Carolina. I take care of kids 0 to 21 years old for holistic pediatrics. And I also do functional medicine for people 2 to 102. Check out my course, check out the full script dispensary and all that good stuff in the show notes. And I am wishing you well. Okay, bye guys.